Today I am going to explain you about such a topic that which is very important and informative for all to know. And the topic is about blood cancer. You know there are three types of blood cancer and the names are leukemia, lymphoma and myeloma. Leukemia generally occurs in the blood and bone marrow. Lymphoma generally occurs in lymphatic system of our body and myeloma generally occurs in plasma cell. And the plasma cells are a type of white cell in the bone marrow. With this condition, a group of plasma cells become cancerous and then it multiplies. The disease can damage the bones, immune system, kidneys, and red blood cell count. This is the lymphatic system of our body, and the lymphatic system is body's disease fighting network. It includes the lymph node, spleen, thymus gland, and bone marrow. And the symptoms of lymphoma are fever, shortness of breath, fatigue, loss of appetite, weakness, easy bruising, pale skin, joint pain, swollen lymph gland in the neck, groin, and armpit. And the sign of this disease include fever, feeling of weakness, breathlessness, loss of appetite, excess sweating at night, itchiness, swelling of the face and neck, unexpected weight loss. These are the signs. So generally, lymphoma is defined as this is a blood cancer that affects a type of white blood cell called a lymphocyte. People with lymphoma make abnormal lymphocytes. It often occurs as a result of solid tumor, often in the lymph node of the neck, chest, armpit, or groin. And these are the risk area in lymphoma. And the names you can mark it from 1 to 10. The points are here. This is the sign or symptoms of lymphoma. Next, blood cancer. Blood cancer is also known as leukemia, and this is a type of cancer which causes as a result of WBC accumulation in large quantity. These cells do not make mass like other cancers. They instead spread to the blood, spleen, liver, and lymph node, and they take up the space of normal blood cells. As a result, the number of normal blood cells generally decreases, which causes leukemia. The exact cause of this disease is still yet unknown. However, it occurs as a result of DNA mutation in bone marrow cell, and the stem cells are the cells in which the bone marrow that produce blood cell. Blood cells includes WBC, RBC and platelets. Mutation in stem cells can occur for a variety of reasons like exposure to radiation and chemicals or due to some type of viral infection also. If the human body is exposed to a radiation for an extended period of time, it causes DNA mutation in stem cell. And this mutation causes a normal chromosome to become an abnormal chromosome, which increase the chances of leukemia. Beside this, some chemicals like benzene can also make changes in DNA, which can result in abnormal chromosome and can cause leukemia. As a result, drinking water containing benzene is prohibited. Beside this, some viruses like human T cell leukemia type 1 can cause infection in stem cell. These viruses disrupts the process of DNA folding in infected cells, due to which mutation in DNA occurs, which can lead to leukemia. This is the sign of blood cancer, and its symptoms include bone pain, bleeding, red spot on skin, weight loss, nose bleeding, severe infection, night sweat, fever. And the risk factor of blood cancer includes history of organ transplant, smoking person, family history of blood cancer, old age, prior exposure to radiation and chemotherapy. These are the risk factors. And the symptoms includes fever and sweats, easy bruising or bleeding, frequent infection, weight loss, fatigue, swollen in lymph gland, bone pain, itchy of skin. These are the symptoms. It can be chronic or acute type. Chronic can be present for long. Acute is fast growing blood cancer. It requires timely monitoring and it requires aggressive intervention. but chronic is stem cell transplant can help here. In acute, it is chemotherapy is commonly used in acute type. And the treatment include biological therapy, radiation therapy, stem cell therapy, and chemotherapy. In bone marrow transplant, normal stem cells are taken from blood, spleen, liver, or bone marrow of a healthy person. They are then given to leukemia patient, while in chemotherapy, anti-cancer drugs are given, and in radiation therapy, cancer cells are killed by radiation. This is the details about blood cancer. I hope this can be very informative for you. Thank you.